Hi, Melissa Cannon with California Food Policy Advocates, and I'm joined by my childcare partners across the state who represent thousands of children and hundreds of family childcare providers. I know I am speaking to the choir when I say that no investment yields as great of a return as our investment in education. But as we've been starting to rebuild the foundation for our early care education system, we've been missing a really critical element. And I'm here today to ask you that as you explore funding priorities for early education, that you bring back the basics. With just one action, we can help to make sure that our youngest learners have access to the food that they need to enter school ready to learn, and that we don't shortchange our efforts to increase funding for our childcare workforce by not funding food and childcare. 6 years ago, childcare providers lost access to the resources that they need to put food on the table for our youngest children. For over 35 years, California actually supplemented the cost of serving healthy meals in childcare to low-income children, but in 2012, at the height of the recession, that funding got cut. After that cut, thousands of children lost access to healthy meals because family childcare providers didn't have the funding that they needed to continue serving food. Other family childcare providers who were more resourced, they had to cut into their already limited budgets to be able to put food on the table. Childcare providers, they want to help the children in their care. They care for our young children. They treat them like family. And when it comes to food, they do the same. But the reality is that family childcare providers are often very low income themselves. They, in order to keep their doors open for our most vulnerable children, often have to get state support. So when they don't have adequate funding to put food on the table, they often are pulling from other parts of their already limited budgets. Since the recession, our state has making strategic investments, and I just want to ask you to support food in childcare. Thank you so much.
Good morning. My name is Charlotte Ochiki. I'm Chief Strategy Officer for Neighborhood House Association. Neighborhood House Association is one of the largest private nonprofit organizations that offers human services to San Diego County. We serve 6,000 meals a day, which translates to 1 million meals every single year. And we simply need additional funding to continue to provide nutritious services to San Diego's most vulnerable families. Please help us help other organizations like Neighborhood House Association offer meals to California's most vulnerable families. Again, thank you so much for your support.
Good morning. My name is Lester Patrick, and I'm from Stockton, and I represent the Hunger Task Force of San Joaquin County, as well as Family Resource and Referral, who supports over 8,300 students, children, and throughout 12 counties across the state. The city of Stockton has a population of roughly 300,000, with 24% of those making less annually of $25,000 a year. I also serve as a director for the Family Resource and Referral, and I hear about situations where service providers on Friday watch students or kids leave their houses knowing that they won't get food until they come back on Monday morning. No child should have to experience this. And this has increased since the reduction that was done in 2012 of this program, because 98% of these students or these children who take advantage of this program are low-income members. And lastly, I work on in a school district with a mentoring program, and students sometimes have to make decisions about whether or not they're going to go on a field trip based upon when they can get back and have dinner. Thank you very much, and I ask that you would support this program.
Hi, good afternoon. My name's Franny Wong, and I'm the Health and Nutrition Manager at the Children's Council of San Francisco, and I'm here in support of item number 1E. I'm speaking here on behalf of the 270 childcare providers that we serve in San Francisco and San Mateo counties, serving over 2,500 children. As you can imagine, with the high cost of living here throughout California, it can be incredibly hard and expensive for providers as well as families to serve fresh, healthy, and nutritious meals. Since the majority of our children that we serve are low income, the meals they receive while in care may be the only meal, nutritious or not, that they receive that day. Many providers are dedicated to offering high-quality organic foods, but they find that they may need to cut back on other areas of operations, such as paying staff lower wages in order to accommodate the high cost of food. Participation in the Child and Adult Food Program acts as a gateway to more in-depth nutrition education and professional development opportunities to improve quality in childcare. Today, I ask you to invest in healthy childcare meals in the state budget. Thank you.
Good afternoon. My name is Astrid Monticlor. I am a research affiliate with the University of California Nutrition Policy Institute. We engage in nutrition research to strengthen policy. And in 2008, 2012, and 2016, we conducted comprehensive California statewide surveys of the nutrition quality of the foods and beverages served to young children in licensed childcare homes and centers. So I'm speaking regarding number 1E. And each survey showed that childcare providers on CACFP served statistically significantly more nutritious food than those providers who were not in the program. Because providers with limited resources have trouble affording certain foods, extra funding would make a difference for the children. Thank you.
Mr. Chairman and members, Brendan Tuig on behalf of Cadango. We're a large provider in the San Francisco Bay Area serving over 4,000 children and families. 95% of the families we serve receive free or reduced cost child care. And we know that children who eat nutritious meals do better both physically and academically. And so this is an important part of our program. We're fortunate enough to get federal funding from the Child and Adult Care Food Program, but the rates for breakfast are reimbursed only at $1.75, and then for lunch, $3.23. So we're a large provider, and we are also fortunate enough to have our own kitchen. But even with that, we struggle to make it work. So you've got to keep in mind that the rates have to cover the cost for food preparation, travel, facilities, and then additionally, the San Francisco Bay Area, of course, is a high-cost region, which makes it even more difficult. So we urge you to make a further investment in the future of our youngest learners by bringing back the state's supplemental meal reimbursement for early childhood nutrition. Thank you.
Hi, I'm also here to speak about 1E. My name is Catherine Stafford. I'm from Cocoa Kids in Contra Costa County, and we represent 340 child care providers in our county. First, I want to say we really need you to fight for this. Please keep it up. I can't think of anything more important than ensuring that young children have access to healthy meals. The high cost of living in California makes it increasingly difficult to purchase the kinds of foods that support healthy growth and development that science tells us is essential in the early years. Recently, one of our large family child care providers in Richmond shared with us that on Mondays the children are always very hungry. She knows that they have had little to eat over the weekend, and her commitment is to be sure while they're in her care they have plenty of nourishing food. She expressed gratitude for the food program, but since the cost of high-quality foods is expensive, meeting the requirements of the food program means spending more of her own limited resources. I want to thank you in advance for supporting supplemental funding for meals to ensure child care providers have the resources they need to serve healthy food to California's youngest residents. Thank you.
Good morning, Keisha Nzewe with the California Child Care Resource and Referral Network. A lot of our members have spoken before me in support of 1E, the child nutrition proposal, and I would just like to emphasize that this is a proposal that addresses hungry children who are often cared for by providers, family child care providers who are low income themselves and may also be hungry. And so on top of everything else that's been said, this would go a long way of ensuring children that aren't hungry while they're in care. Thank you.
Hi, Tracy Patterson with California Food Policy Advocates. On behalf of our own organization, we support a number of these proposals, 1D, E, H, I, and K. But I'm speaking in strong support of item 1E on behalf of the Child Food Program Roundtable, which is comprised of 163 different organizations throughout the state of California that support child care providers to provide nutritious food. That includes the Pasadena Mothers Club Family Learning Center, the LA Regional Food Bank, the Orange County Head Start, Orange Children and Parents, Goleta Early Childhood, the Head Start of Santa Barbara, Ventura Child Care Food Program, and the Community Action Commission of Goleta, among others. Thank you.